Hi, everyone. This is Team Bears. I am Dr. Hani Stoklosa, emergency physician at Brigham and Women's Hospital in Boston. And our project's focus is on building access, empowerment, and resilience, trauma-informed care in the emergency department. We know that emergency departments are high-stress environments, which are traumatizing to staff and to patients. And we know that that trauma plays out on individual, interpersonal, and structural elements. We did a survey of the community that surrounds Brigham and Women's Hospital and found that in high priority neighborhoods surrounding the hospital, we know that the communities that we serve are facing structural oppressions, including poverty, unemployment, health inequities, chronic disease, and shortened life expectancy. A trauma-informed approach offers a framework that is intended to improve outcomes for both patients and staff by reducing re-traumatization, decreasing vicarious traumatization, and promoting health equity. However, and the reason that we need our project is that there really is limited data on acceptability and feasibility of trauma-informed approaches in adult emergency departments.
To develop our research aim, we started with a deep dive in the literature. What is out there about trauma-informed interventions in emergency departments? And we realized the existing data is very limited, often restricted to particular groups of patients or to limited interventions like one-time meetings. And we believe that our project must start with understanding what the emergency department community needs and wants. And thus our aim must be based in the voices of these physicians, PAs, nurses, social workers, security officers, front desk staff, environmental services, and more. Many of those people have not had a voice in designing or implementing interventions, and thus our aim focuses on this task: understand the acceptability and determine the feasibility of trauma-informed care practices in an emergency department. And once we have answers to these questions, we can move on to develop interventions.
So in order to understand this, as Eve said, we had a purposeful sample using snowballing to identify key stakeholders in the emergency department. And those interviews have been well underway. We are probably 3/4 of the way of collecting our data. And for this, we recorded interviews that had open-ended questions. And those interviews have been recorded and are being transcribed, and using a grounded theory and constant comparative method, we were able to look at some of our results, which will be shared with you shortly. Again, as Dr. Rittenberg said, once we complete the analysis of these interviews with our staff, we will then move into phase 2, which will be the development and implementation of our intervention.
Preliminary findings based on the completed interviews so far and the ones that have been analyzed show that a majority of subjects are familiar with the term TIC, trauma-informed care, and would be open to using a trauma-informed care protocol. They reported that they need more time to better address trauma-informed experiences, and that when interacting with a patient who's experienced trauma, they hope to provide comfort and emotional support to the patient. Interestingly, there was spontaneous report that individuals experiencing trauma tend to be from lower income and SES communities, and other communities that were reporting experience with trauma included those with addiction or mental health disorders, homeless, disabilities, women, prisoners, and immigrants. And there was a majority of subjects were reporting some implicit bias within the ED staff with regard to race. The most frequent reported barriers to implementing a trauma-informed change in the ED are lack of time for training and implementation, and the potential cost of implementation.
And next steps is that we are looking forward to completing the stakeholder interviews, hopefully by November 1st of 2020, where we complete an analysis of quantitative and qualitative data that we've gathered. And we're going to identify and develop an intervention that's based on that data. So in a sense, we're doing trauma-informed care research, and that we're not seeking to move ahead with our next steps until we really hear the voices of everyone that we are able to get an interview from. And then we hope to implement and evaluate our completed intervention after we have finished it. Thank you.